Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Okay, but Lightning wrote in and said, how can stimming be controlled? And I know Becca had to leave, but Becca responded, and Becca had identified herself at the beginning of the show as somebody who's on the spectrum. And she said, you know, it's really important to let people stim, and that if she doesn't stim, that she would self-damage. And so I really want to open this conversation because I think sometimes the way we language things is really important. So maybe if you could start by telling us what stimming is, because I think there's a misunderstanding there. And then I understand as a parent, when a parent says, well, I want to control the stimming, I understand what they mean, which is how do I help my child be able to do more than just stim, right? But then on the other side, for our self-advocates, it's like, please don't try to take away things that are helpful and useful to us. So help us out here, Dr. Granpeesheh.
Yeah, let's talk about stimming. So first of all, stimming or self-stimulatory behavior refers to one class of symptoms that are present when you diagnose someone. They have to be present. They're part of the symptomology of autism. And they can be different things, but the characteristic that defines them is that they are all repetitive, stereotypical, and don't appear to fulfill any kind of, adaptive function, I guess. So, for example, things that fall under the category of stimming or self-stimulatory behavior are things like, let's say, my lighting here is changing. I apologize.
Oh, we didn't notice.
Yeah, so there are things like, for instance, putting your toys in a particular line, a perfect line, or looking at objects that are circular, like the ceiling fan, or doing these types of things in the corner of your eyes, or even body rocking, there's lots of different types of behaviors. And they all kind of fall under this category of self-stimulatory behavior, right? Now, from a, I guess, medical perspective, we don't know a lot about what causes the self-stimulatory behavior. There are some people that believe that the body rocking in particular helps calm the individual or helps reduce their, if they have gastrointestinal pain, for instance. But this motion in general of body rocking does stimulate the parasympathetic nervous system. So it is something that calms, which is why we have rocking chairs, right? Because it's a very calming motion. So there are theories about what causes the stimming. I always say it's funny because it's called self-stimulatory. It should actually be called self-relaxing or self-soothing type of behavior. I personally, my take on self-stimulatory behavior is that they shouldn't be classified as one. They each have a different function, in my opinion. So yes, there are things like this that might be calming. I think when we're looking at things like lining objects up, that's more of a compulsion. When you have obsessive compulsive disorder, which a lot of our kids also have some aspect of having obsessive compulsive types of behaviors, doing the compulsion is you do that because there's so much stuff bothering you with the obsession that the compulsion helps relieve that pressure. Now, with normal people who have, let's say, OCD people, right? People who have OCD, what the obsession is like, oh my God, there are lots of germs everywhere, and the compulsion is, I'm going to wash my hands, right? So that becomes their cycle. But I think with our kids, there's such a they have control over so few things in their environment that they do these things in order to gain some control, and also because it's calming to some extent, right? Like they will hoard objects, they will put them in a very patterns, right? Which also, by the way, potentially could be patterns that are somehow meaningful for them, because as we know, some of our kids see things completely differently than we do. They have sensory regulation that's different than ours, right? So I don't like to call it dysregulation, because I feel like they just see things in a different way than we do. Than the rest of the world does. So some of these visual types of things, like lines and looking at objects that are circular and so on, to me is some response from their sensory needs. They're doing something because they from a sensory perspective need to do that. And earlier I was reading a lot of the stuff that Becca was writing, and I think a lot of that is the same, right? We have certain needs and we respond to them that way. Now, do we want to eliminate self-stimulatory behavior? As Shannon said, it's a hot topic, because sometimes people who have autism will say, "Oh, leave me alone. I don't want you to change me." And that's perfectly, totally fine. But the way I look at it is, we all are, in this world, and we kind of have to live by the rules of this world, right? Fortunate or unfortunate. Like some of our folks are very, very sensory sensitive, so they can't they don't enjoy putting clothing on. But that doesn't mean that it's okay for them to walk around naked, right? We actually shape their behavior and teach them to keep their clothing on, because that's what society rules expect from us. And a lot of times when we're doing self-stimulatory behaviors, we're not engaged in anything else. We're so focused on this particular self-stimulatory thing that it takes us away, it isolates us from everything else outside, and it prevents us from learning, right? It prevents us from socializing. It prevents us from getting friends. It makes us lonely and alone. And so and it also makes us fall behind, because we're not paying attention to the teacher. We're focusing on whatever it is we're doing with our hands. Now, my feeling about it personally, Shannon, is that as long as the person and their guardians, or people who care about them, feel that the self-stimulatory behavior is calming and it is not detracting from other aspects of life, then I think it's perfectly fine, right? I mean, a lot of people will, I'm looking for a pencil, but like people will like tap a pencil, chew on a pencil. I don't know, people do this
Click a
with their
pen.
knuckles. I mean,
Yeah.
we do all kinds of stuff that could be classified as self-stimulatory, but they're not necessarily things that will prevent us from doing other things. And we can stop doing them in order to do those other things, right? When it starts to detract from other aspects of life, and when it's important, like a lot of parents will tell me, I want my child to pay attention and learn language. Okay, then I do need to stop the stimming, because if he continues the stimming, he's not going to be able to pay attention and learn language. So
Yeah.
it's a balance, right? At the same time, there's this thing called the Premack Principle, which it basically says that if there's something that's extremely rewarding in any way, then you can use it as a reinforcer for other behaviors that are less rewarding. And so if self-stimulatory behavior is very rewarding, it's very calming, I will often allow my patients to self-stimulate at intervals, right? So I will allow them to self-stimulate as a reinforcer. I'll stop them. I'll have them do whatever it is, like their language exercises or their game or their interaction with someone else or whatever it is I'm trying to teach them. But I will definitely give them the opportunity to go to their room, have an area of the room where it's safe and they can sit in their beanbag and self-stimulate and whatever it is, as long as the next time there's an opportunity for social interaction, they're willing to let go of that and come out and interact again. So it's kind of like helping the individual regulate themselves and give themselves some of the reinforcers that they need, but then also do the things that society requires of us.
Absolutely. It's a tough thing, and I think it's tough to understand, but I love to use the example of Dr. Temple Grandin,
Yeah.
that she still loves to talk about. There were two things that she especially liked to do that would come under the stimming heading. There was a metal plate on her bed that was on a screw and it was loose, and she could spin the metal plate. And she said, I could spin that for hours. I still could spin that for hours. And
Yeah.
she's at a point in her life where she's able to talk about why. And she, like, you get her talking about it, she's like, oh, it's so good because I can make it go slow and the light reflects differently on it, or I can make it go fast. And she's like, it's such a soothing thing to me.
Yeah.
And her mom looked at that and said, okay, you like to spin the plate on your bed, that's great, but it can't be the only thing you do in life.
Right.
So you can spin it for an hour a day, but then you have to go muck the stalls. And by the way, you're good with how you draw, and you can't draw and spin a metal plate at the same time. So you get an hour a day to spin the plate, but then you have to go muck the stalls and draw the horses.
There you go.
And then eventually you have to draw the building. And look at the career she's had. If you've never seen the pictures, the
Amazing.
schematics that she draws, and she says, if my mother had just let me spin the plate, that's all I would have ever done. That's all I would have ever been, is
That's right.
somebody who spins a plate. So it's hard. I think we have to be very mindful of the souls that we love, and be gentle and kind, and not try to completely remove something that's calming somebody down, but not let it limit them. Like you said, when it begins to detract from other things,
Yeah.
how can we then turn it into a reward so that it's not a constant thing?
That's right.
So it's a difficult thing, but I want to I wanted people to hear you, because I think a lot of times people on the spectrum think what you said. You're trying to change us. You're trying to make us like everybody else. We don't want to be like everybody else. But I meet a lot of people on the spectrum who have one frustration point. They're like, I want a date, or I want a job. And sometimes there's something stopping them from being able to do that. So we have to help them to find the way, right? And this is just one of the
Absolutely.
things on the list.
And by the way, it's not just people on the spectrum, it's all of us. It's
Yes.
all of us. I mean, we all start out, and earlier I was saying, like when we're teenagers, we don't know. Well, the most valuable lesson I think that I ever got from my dad was that he always used to say, whenever you don't know which direction to go, choose the middle. Because the middle, like in life, we tend to go so extreme when we're younger, right? We go and party like crazy, and then 2 days
Or follow
we're
Genesis around for months.
exactly.
Right.
And not even attend any classes, exactly. And then you're like, okay, well, that was a little too extreme. So how can I do that, which is not, how can I get that reinforcer but not like obsess over it, right? So like now, this time that I'm following them, I'm working. I'm still working during the day. I'm writing, I'm doing a whole bunch of stuff, and then I see them at night. Whereas, so that's kind of learning. All of us, we learn over time to balance our needs, right? And so we also have needs that could be just like stimming.
Yes.
They're exactly the same. Like, what, it's something like doesn't necessarily do anything, but it's very calming for me. Let's say to lay down, listen to music, read a book, take a bath, whatever it is. And but that I don't do that 24/7, because there's another part of me that has to do with socializing, interacting, learning, and all of that.
But it all goes back to my favorite quote of yours, which is, it has to be fair. So
Yeah.
when we're teaching our kiddos, we want our kiddos to learn and to grow. And if Temple's mother had only ever let her spin the plate, she wouldn't have learned and grown. But mom did not, Eustacia did not say you can never spin the plate. It has to be fair. So we have to think about, what do our kids want and what do we want for them? And we have to find the fair way. And I
Yes.
love that good ABA, which is what Dr. Granpeesheh does, looks at exactly that and says, let's make it fair.
Yeah,
So amazing.
absolutely. And sometimes, and always remember, folks, when you're doing when you're just starting out changing a behavior, there are more reinforcers. In other words, it's super fair. Like it's more tilted towards heavy reinforcement. And then over time, you increase demands and reduce reinforcers so that it becomes more like real life. But in the beginning, it is skewed to have much more reward and reinforcer. That's called shaping, because you never want to like suddenly cut out a reinforcer that the individual is used to, because then it'll become an aversive situation for them.
There we go. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.